there were questions in the Q&A. And so the first question goes to Mr. Neaz Subhan. What were your defense mechanism during the trying times during COVID-19, since you were completely isolated from the world? So, Mr. Subhan?
Yeah, I think my defense mechanism, because if we're speaking specifically during the 50 days that I was at the COVID unit, I am grateful that maybe even the irony of life, that because of what I went through before, at that point in the COVID unit, I wanted to live. I really wanted to live. And, you know, if you allow me, you know, I couldn't see my family members except on the telephone. And I tried to avoid that for the early part. But then one day the doctor said it might be useful if they could come and stand on the sidewalk outside of the hospital, and I could see them through the window. So I did that, and it was very painful because I could see them, they couldn't see me, and you know, and I realized that, you know what, I just have to go through that. I have to pull on the strength that I had before, and I want to believe that whatever I went through the years prior to that really prepared me in many ways for situations like what I experienced in the COVID ward. Had I not gone through what I go through, who knows? I might have succumbed, because I was able to tell the doctors at some point, I was brave enough to tell them that I am slipping mentally. I feel depression is coming on, and I want you to know. And they immediately got persons, the requisite skill set, people with this requisite skill set, pardon me, to work with me via the telephone, because at that time, those people could not come into the ward. And I'm very happy that I was able to do that for my own self, for my family. And I believe your question directly, the defense mechanism, I believe in many ways was my own experience. I don't know if I answer your question.
All right, so thank you for that. Thank you. The person said, can you turn the system side? Mrs. Subhan, can you share where we can get your book from?
It's not intended to advertise, but it's available at Austin's and Giftland, and it's also available. The Kindle version is available on Amazon.com.
Okay, so thank you, Ms. Martinez. You can get it Austin or Giftland or on Amazon Kindle. So feel free to access it there. So thank you very much. So now we will have our discussion, and now we're going to focus how can Guyana mental health in Guyana improve through carer support? So we will start with Dr. Hoven, and then we will take Professor Helen. So we'll start with Dr. Hoven.
Thank you. Well, again, I want to thank everyone on the panel for their not only their telling their story, but telling it so eloquently that it certainly has to touch the hearts of all of us. It's always wonderful to see a life saved, a life turned around, and to appreciate what it takes for that to happen. And I think what we've heard is that you know, a person has to recognize, as Mr. Subhan did, what were the positive things that were available to him and that he felt responsible for. And as we heard with Dr. Breshnahan, what were the things in her life? What were the responsibilities that she had as a mother, which trumped everything? Um, but, you know, I think it's also fair to recognize that those two people, and I can't speak for Cindy, but I know that those two people, at the point in their life that they were making those decisions, had probably more resources available to them and their family than many people. And so when we think about Guyana, we have to think about a country that has all levels of resources. But for the most part, we're talking about a majority population that has limited resources. That's a fact. And so what can we do? What can we do in an environment? We've seen what Mr. Subhan has been able to do as a Guyanese. He referred to coming from a small village. But what can we do in a country, this country, Guyana, which is an under-resourced country, and yet, as with the cases we've heard today, it's the family. It's the family. Mr. Staglin talked about his family. These are families that came to the realization, and frequently slowly, what they needed to do to save their loved one. But what can we do so that it doesn't happen so suddenly in adulthood? What can we do about normalizing mental illness in children so that they understand that this is a fact of life, that many, many people are going to have problems in their life, and that it doesn't diminish them as our family member, and that we have to find ways of loving and caring for people. But as a society, aren't there obligations to develop educational systems to make that happen more easily and more readily and more naturally? So what can we think about changing in Guyana? What are the structures in Guyana that we could think about changing, supporting, to make it easier and more natural to support the family members that we love, who are, you know, without a doubt, we are going to have family members who are going to have mental illness. That's a fact. So why should it be such a challenge? Why should Mr. Subhan have felt so stigmatized that he needed to hide it for so many years? So many years. Why did Cindy feel so, that she needed to pretend it wasn't true for so long, and then come to the realization, what can we do as a society to make that decision, that recognition, and the obligation and responsibilities that we feel a more natural, supported outcome? So again, I ask people here from Guyana, I ask our panelists, what are the things that we can do? The people who've had the lived experience certainly have some ideas. What would have been better had people realized and felt more comfortable and less stigmatized at an earlier point?
All right, so we have our question for the panelists. So we'll ask Professor Helen to go first.
Yes, well, thank you. I wonder if, would you like me to go first, or would you like to hear from the panelists in response to Christina?
All right, so I see Neaz would have raised his hand, so we'll ask him to respond to Christina's question, and then we'll have Brandon share.
I raised my hand in the context of what was said in terms of what the Guyanese can say in terms of what we can do here. For me, and she mentioned about the under-resourced quote-unquote projects. For me, big on all of this is awareness, is an educational campaign, targeted educational campaign on awareness, to educate people on mental illness, what is mental illness, what is mental health, you know, something as basic as if you're not happy for whatever reason, could be something impacting your mental health. I'm not an expert, but I believe if we create a targeted educational awareness program to educate on what mental illness is, I would want to believe that over time, and you embellish that with other necessary interventions that allows for counseling, sustained counseling, confidential counseling, mechanisms that people can reach out. I don't believe we have that in an effective way, and I'm being honest. If we do that, then I believe over time we can be able to break the backbone of the stigma. The stigma is the biggest thing that is really holding a lot of people back, regardless of who you are in society. It probably is even worse in the small villages, because in those villages everybody knows everybody else, right? How do we get to that level, let people to understand that, you know what, this is something that we can work together in trying to understand it and in trying to break the backbone of stigma. That's a very broad approach. So I just want to put that out there, and maybe the panelists agree, and whatever resources can be made available, then you can now zero in on the specifics as we go along over a period of time. Thank you.
All right, so I see in the chat someone would have put that we needed to include mental health education at the school system, in the school system, and at all levels. And someone else put awareness and education campaign must begin with our young minds and the school. So again, we're seeing a lot of education awareness coming out from the chat as well as our panelists. So we'll ask Brandon to unmute his mic and go ahead to answer Christina's question.
Yeah, thank you. And thank you to Mr. Subhan for his idea on an educational campaign. And I agree, that's incredibly important to destigmatize mental health and anywhere in the world, including in Guyana, including the United States, where I live. In the United States, we've done a very similar process over the past 10 or so years. And this is essential for actual change to happen. The stigma has to change for advocacy to be effective. Is when people talk about mental health in an open way that shows that they care about the issue, that will motivate policymakers to make changes in the way programs are offered throughout a society. And we're seeing this start to happen. So I'll give an example. So we've learned from my experience, my family's experience, launching a program in the US called Bring Change to Mind, which is a nonprofit which has become very prominent here, that enlists celebrities as well as people, their own lived experience across the nation, to share their stories, just as Mr. Subhan has done, just as Cindy has done, just as Michaeline has done. It's really important that people such as these folks here and everywhere are able to share their stories about mental health challenges they've had and what they've done to address those challenges, because contact education, that's what this is called, is so important for reducing stigma. Contact education is when somebody who is not familiar with mental illness or feels prejudiced about mental illness hears a story from somebody who's experienced it, and that humanizes it for them. They realize it's not a character flaw. They realize that person is a valid, whole human being that deserves compassion, that deserves support, and that is an incredibly effective way to make change inside someone's attitudes around mental health and mental illness. So if the educational campaign that Mr. Subhan proposed includes contact education, people sharing their stories in a way that is empowering to hear, that can be a hugely effective way to address this issue. And then in turn, begin to support the advocacy that can actually change policies in Guyana or as has been the case in the United States. So that's a wonderful idea, Mr. Subhan. I hope it succeeds where you are.
All right, so thank you, Brandon. It's important that we allow persons to share their stories so they feel a part of what is happening and they feel a part of being a part of the new normal, because we have to understand that these persons living with mental illnesses, that's their normal. And so helping them to share their stories will help them to feel a part of who we are, who consider ourselves healthy and normal human beings, persons living in society. And so we also have someone in the chat saying that we need to support carers of persons who are having mental health by simply giving them the necessary love and support. Also, there is another person. My idea is to get professionals that are not culturally biased on the age groups and the age groups about mental health. Also, we have another person saying to Brandon, how do you cope with schizophrenia on a daily basis as a working class?
Yeah, these are great ideas. I'm happy to answer that participant's question. So schizophrenia is hard when you're in a working situation. When I was diagnosed, I was 18. I was in college at the time. I was able to recover with the factors that I mentioned in the previous panel: loving family support, early science-based medical care, and continued community involvement to stay active and engaged and continue growing. I was able to recover well enough to go back to college, finish my degrees, and go on to eventually, after 6 months of searching, find a good job to work in, which was engineering, something that I'd studied to do. But in the workplace, that was very hard. Not only because, well, the main problem that I was experiencing then was the stigma and the fear of discrimination. I didn't tell anybody when I was interviewing for the job that I had schizophrenia. And I felt that I'd be possibly fired or ostracized once I was there if I revealed to any of my coworkers that I had schizophrenia. And having to hide that from day to day, having to police my thoughts and feelings every moment for fear that I'd reveal something about myself that would make them see me as crazy, was extremely exhausting and caused me to isolate to some degree over time. It was just easier not to be around people and feeling like I had to hide this. So, stigma is a huge issue. In the US and around the world, there are efforts to improve the situation in workplaces. One Mind, my organization, has a division called One Mind at Work, which aims to change the culture of workplaces around the world regarding mental health. And we've enrolled about over 100 companies to be involved in this work, including very large companies and smaller ones as well, with the purpose of helping them understand that people with mental health challenges in the workplace deserve support, deserve acceptance and empowerment, just like anyone else in the workplace. And to provide those supports for those people through insurance, proper insurance coverage, through culture of acceptance, through services that can be offered, such as employee assistance programs that employees feel empowered to use, and other such things. And so things are beginning to change around the world. And there's actually an organization that operates in the US called Zavicon.net. There may be something similar. I don't know if there is in Guyana, maybe not. But I hope that there can be organizations like that help people with mental health challenges connect with employers, and employers connect with people with mental health challenges, so that there can be a win-win situation where people with the mental health challenges can find employment that supports them and that they can succeed in. That's really important for recovery for anyone.
All right, so thank you. So we have an opportunity to link with Brandon so that we can bring such service to Guyana and help companies to help support persons who are living with mental illnesses. Great. So we can have some networking happening. So we'll ask Brandon to share his information in the chat so persons can email, call, or message if need be. So we'll have Christina share now.
Yeah, I would like to ask you, Brandon, do any of these workplace programs that you just mentioned, do any of them include support for family members, for carers? Or are they all geared towards helping the individual employee with their own challenges?
Yeah, that's a great question. They do involve family members and carers. It's recognized that the family is an essential component of supporting the employee and vice versa in these workplace mental health programs. And so that is an essential component. If you'd like details, I'm happy to respond more offline. I need to refer to my colleague who runs that division for more details on the programs themselves that are incorporated through One Mind at Work, but we'd be happy to do that more offline.
All right, so thank you. I see Ellen raised her hand, so we'll ask her to go ahead, unmute her mic and go ahead.
Yes, thank you very much, Alicia, and taking up your previous offer too, but after these very rich additional comments that we've heard, I'd just like to echo with everyone we've been writing in the chat, but it's been a really wonderful sharing of the experiences and people being willing to tell us about the pain that they've been through, as well as the difficulties, the needs. And I thought to follow on from what all of you have been saying, and Christina as well, that in a way we're thinking about what can be done in Guyana, what can we learn from elsewhere, and what can we learn from the failings of elsewhere, but primarily what do we learn from the remarks that have been made. And I must say that one of the things that stands out to me listening is the experience that comes from several of your accounts of isolation, particularly thinking of the carers. Mickey described it very clearly, being left by family members to take care of her son. And this is, I think this is something for us to consider as a panel, because it's not an uncommon experience, as we hear from other places and other people, that the family member who is taking care either feels stigmatized, as Cindy described, or also is avoided somehow by the rest of the family. People either don't know what to do, don't know how to reach out to that person in an appropriate way. So it's how do we can either frame it as neglect and cruelty, or we can say, I think as Mickey has done, that she understands that others have difficulties, but it doesn't make it any less painful. And it's also very difficult for people to discuss. So I think the experience of carers and their need for moral support, as well as somebody wrote in the chat, financial support, this is a very important component. And in a number of countries, including my own, there are carer support payments. This recognizes that in part the fact that carers often have to give up employment or to give up career aspirations. In some cases, I'm aware of that it actually stimulates a career, but quite often it means that people live in sometimes even impoverished circumstances, or certainly less well than they would otherwise. Then there is that, you mentioned that the whole question of stigma and feeling unable to know what to do. So the importance of awareness, of education, and I think, did somebody mention helplines? I don't know what the experience is in. I think Mrs. Subhan, you may have mentioned the need for somewhere to reach out. Perhaps there are helplines already. And it needs more than that, of course. The helplines need to be able to refer to other services. And then we've heard about the experiences of people with lived experience themselves and how they need the kind of support and understanding that we've described. But I'd like to move on also just to mention the needs of the service systems, that there's educational needs. And in places, there are, of course, arrangements whereby it's both family carers and service users are employed as liaison, maybe as peer supporters, but also as liaison with service management. And in a service I was working within Melbourne over a number of years, we were mandated by the government to employ service user consultants as well as people with lived experience consultants. That was a very valuable experience. But what we didn't get to, but I think is an important experience of that is being used around the world, which is involving carers and people with lived experience as educators, being part of curriculum development for healthcare workers and social care workers, being part of the examining bodies. So what's it like to be interviewed by this person? What sort of understanding and listening do they display? And also being involved in the genesis and the conduct of research studies is important for understanding the local needs in particular. And finally, just to mention that one thing we need to get to grips with, I think, when we're thinking of the interaction of people who are seeking support and those who are employed to give it, the healthcare workers, is the kind of dilemma about privacy that some healthcare workers, particularly in psychiatry, find it very difficult to discern how to manage privacy. So say say Brandon, you'd been in a different situation as an 18-year-old. You had a family that was very demanding and not understanding, and you didn't want to tell them about your experiences. Well, and Neaz, well, Mr. Subhan, you had that experience. Perhaps the person treating you may have either told them or they may have got the understanding that they didn't want to tell the family what was going on. And in some places, of course, there are laws that say there are privacy provisions. But generally, certainly my experience and that of many people is that usually with discussion and understanding that it's possible to work out how to engage families appropriately and how to preserve, if there is a need for privacy, to understand exactly how to preserve that, but not to use that as a kind of, I don't know, perhaps a defense sometimes against engaging with families because of the perceived complications of doing that. But the other thing about service systems in Guyana, or perhaps anywhere, my own service systems, is that people feel you need special skills to engage with families. Well, you do. We all need special skills to engage with others and to put ourselves as a person into the work as well. But it's a part of regular activity, it's part of regular care, and we need to make sure that the people we're training in healthcare and supporting in healthcare and social care see this as part of their job. So I'd see that as the sorts of things that we could be discussing in Guyana to see if it applies.
Okay. So thank you very much, Professor Ellen, for that. So we all would have heard what are some of the things that we can do and what we need to do to support persons with mental health issues. However, we had one question. So how do we help people with MNS disorders who use substance. How do we help persons with MNS disorders, which is mental, neurological, and substance use disorders, who use substance? I'm thinking they're talking about drugs or alcohol. How can we help to support those persons? Anyone from the panel, you want to answer that?
Just comment briefly that I think this is a really important question, because sometimes people self-medicate, and this is part of who they are and the problem that they may come that's seeking help for. But too often we keep everything separate when the substance use problems are very common in many countries, and we tend to say, well, you have to deal with your alcohol problem before we treat you for mental health problems, or we can't treat your alcohol problem until you've seen the psychiatrist, rather than having the services work together.
Yeah, I would just like to say that we have an outstanding panel here and an outstanding opportunity to actually address the question that this second panel posed, and that was, what can we do or suggest for Guyana to put in place whatever that would help to mitigate the outcomes that we've heard here today. You know, I think I opened this whole session saying that I see this meeting this week as an opportunity to start doing some of the things in a concrete way that we need to do in Guyana to not only address suicide, but to address the problems of mental illness in general. And so I'd like to, if we could, spend the last few minutes. I think we heard from Mr. Subhan some very clear message about do something about stigma and about education. We heard from Brandon about education and the need to do that, and we heard from Mickey about family support. But what are the specifics that people and this panel and this audience, and it's a very attentive audience, both online and sitting in the room here, what is it that we can suggest? Because on Thursday morning from 11 to 12, we're going to try to have a wrap-up session in which we actually identify some concrete ways of moving forward. And as I said, on Monday, I see Monday next year coming back and looking at how well we're doing. And so today I want to use this outstanding panel to help us identify what are those things. Are we talking about supporting a respite service, for example, where parents of a disabled child gets to have a few days off once a year to get some relief for themselves? We're talking here about the carers. What can we do to make the life of the carer better and therefore more supportive of the person who has mental illness? Whether it's a parent who has the mental illness and it falls on the child, or it's the child who's dependent of the parent, or it's a spouse who all of a sudden becomes mentally ill, or is an adolescent. So Cindy was talking about young people. What is it that we need to do as a society, as a mental health division, if you will? What can we do? What are those concrete things? So again, I turn to the panel in these last minutes to try to help us identify what those are. Thank you.
All right, Christina, if I could go ahead and jump in here.
Yeah, feel free.
All right, great. So, so one thing that I think we could do in order to help our our carers. I know we spoke a lot about education, ensuring that they understand the various mental issues that they're going through, etc. But something that we could do immediately is actually starting support groups of carers. Because yes, our carers are there giving support to their family members or relatives or friends that are living with a mental issue, but we can do a support group for them where they sit and where they talk about, 1 second please. My apologies for my background noise. I'm currently in Region 1, Moruca, doing some school sessions, and something was passing. So as I was saying, we could start support groups of carers where these carers could meet at a safe place and where they could talk about their experiences as carers and where they can learn from each other as to what they're doing for their family or their relatives, right? Our carers need a safe platform where they could divulge and where they can share. So I'm thinking immediately a support group would be very effective, where they can come, whether it's at the mental unit or another safe place, and just have discussions about how they're helping. And in terms of another thing that we could do is ensure that our policies that we have, we need to revise our policies and our laws to make implementation for support for the carers, whether it's financial support, whether it's educational support for persons who would like to become to take this as a profession. So we need to ensure that our policies are and our laws have things in place for them. I know in the UK, because I would have done my master's in the UK over the last, in 2018 to 2019. And what I like about the UK system is that they make financial provision for carers, whether it's providing a food voucher or transportation voucher or gas for those persons who have to take their loved ones to the institution, to the hospital, and these sort of things. They, in the UK, they have a system in place like that. So I'm thinking that those are the two things that we can do immediately. Starting a support group for our carers, whether it's virtual or in person. We could ensure that our policies have provisions in place for our carers, and make some sort of financial, if it is not financial stimulus, it could be vouchers, as I mentioned earlier. So that's my recommendation.
Thank you, Cindy. Now we have Mickey.
Hi, I can't agree more. The crucial support, particularly in the early days when you're starting to confront your change in life, you know, your life has changed, is the support of other people in the situation. It's important because they are not other. They're not, you know, the health establishment. They're not the educators. They're, you know, they're just like you. They're having this experience, and they can provide really a crucial link to everyday problems that you have. But those groups, you know, you need to be able to, outsiders can perform a service by giving you a place to meet. And that having a place to meet is not unimportant, particularly if you have to drag kids with you. But there are other things that can arise out of that, including a kind of activism among the families, where they can, as Brandon's family has clearly illustrated, but there activism that reflects your situation. For example, after a certain point, I couldn't take my son into the bathroom with me in public spaces. You know, at a restaurant, I needed to be able to take my son into the bathroom so he could go to the bathroom, and he had to go into the women's bathroom. And in some states that was illegal. You know, the legalities, I mean, this was a simple thing. Family bathrooms are not where both men and women can go, are not prevalent. So there are simple things about carrying out your daily living that are a barrier. You know, did that, you know, if I can't take my son to the bathroom, does that mean I can't go out with him? You know, unless he can, you know, manage the amount of time, or I can only go out with him for this amount of time. Families can be very, very effective in pressing very simple everyday needs. They can be effective in the workplace. They can be effective in, you know, in the public place. And when you get together like that, you can identify common issues that are really barriers to carrying out a normal life. I also agree that respite care is very important for people who are in the business of 24-hour caretaking, either end of the life spectrum, if you're taking care of someone with Alzheimer's, for example. And that can be very useful. The one thing I would like to right now advocate for, which I had not thought of until just this minute, one of them, while we were talking, education is really important, but I think modeling behavior, the people who've been most successful in inserting themselves into my life have modeled their behavior after someone who is successful in interacting with my son. You know, they, and modeling behavior is, it's not always, you know, understanding, you know, that the situation is different is one thing, and being tolerant of it is great, and not judging it is great, but modeling behavior to make, you know, where it becomes normalized, you know, this is a normal part of reality in this household, that there is a person who, you know, has a difference. And that could be any difference. That could be schizophrenia, that could be Alzheimer's or autism, it could be anything. Or mental retardation, anything. Being able to model successful behavior that creates normal interactions between people, it would be extremely helpful for all of these disorders, and somehow go beyond just saying, you know, oh, this famous person has schizophrenia, and this famous person has epilepsy, and this famous person has a child with autism. You know, that's important because that brings us into the group of, you know, acceptable people. But knowing how to make a life out of that. Do you know what I mean? While it's going on, you need to have a life. You don't want to just be like a therapist, you know, to your loved one, or, you know, you don't want to be therapized by your mom. I mean, you know, if you have a disorder, you don't want your mom to be your psychiatrist, you know, or your social worker, or you this or that. You want your mom to be your mom and love you and support you and, you know, be there for you. So ways of being are never conveyed. No one ever talks about ways of being that make life a life for the family and for the individual. And I would like to recommend, you know, lay activism in all of these areas, because I think that and it in many instances, unlike education, it doesn't cost anything. You know, it doesn't cost anything. So, and I think that the cost-free solutions are really, I don't think that, you know, these are applicable across cultures, but they need to be understood within the culture, you know, so it can't come from outside, but from within the culture, it's a sense of empowerment. You know, I deserve a life. My child deserves a life. My brother deserves a life. My mother deserves a life, you know, and having that confidence that that you deserve a life it will give you the will to move forward and improve the environment bit by bit. That's it.
All right, thank you very much, Mickey, for that. Also in the chat, have a national action plan with stakeholders and community involvement. And then someone else said we should have centers for persons living with mental illness so that the families can have breaks and take time out for themselves. So that was our discussion for this morning on how can we in Guyana improve support for carers, persons affected by mental health? So we will ask our panelists to give their parting words, because I can see some of the persons for the next panel is here. So we'll ask each panelist to give their parting words, and then we will close the session. So we can start with Brandon. I'm seeing him first.
Thank you very much. I feel honored to have been on this panel and grateful to interact with the other wonderful panelists today and learn from them. Parting words, I would simply say that if you are a carer for somebody who lives with a mental health condition, remember that even though sometimes they may be behaving in ways that are hard to understand, that are hard to cope with, they are still that person that you knew before they developed their condition. That there's still that loving person inside, even if they may not be able to express it at any particular moment. I've gone through this myself with my schizophrenia, as I mentioned in the previous panel, and that it's worth it, and that they appreciate the work that you're doing for them. They may not be able to express it at any given moment, but the appreciation is there and will surface, and you will feel it in time. So as somebody who's gone through a serious mental illness, I want to thank all the carers out there for caring for their loved ones who go through these conditions, because your work is incredibly important, and I hope you will find the support that you need to carry on and the strength that you need to carry on to support your loved one as they will very much need from you. Thank you.
Thank you, Alan. Professor Allen, can go ahead.
Sorry. Thank you, Alice. I'd just like to say that this is a very important start to a national discussion. And I think that the question, you have an opportunity on Thursday, and the ideas that everybody has put forward and the suggestion of some kind of a national conversation about this, it'd be very interesting to hear how that how you proceed with that, and feel that there's plenty of energy and plenty of expertise in the room to make the lives of carers better. It doesn't only rely on resources, as we've heard. It relies on attitudes and on the people getting together to be empowered and empower each other. Thank you.
Thank you, Cindy.
So I would just like to let carers know that I know that at times it might seem very frustrating. At times it will place you in a position where you're fearful, where you're wondering if you're doing the right thing. But just know that you are making a difference in that person's life. And to continue just doing the good work, continue making the difference, because at one step at a time, we can change the narrative of mental health. And as family members that are providing care and support, you are important. So thank you very much for joining in the fight for creating change in the area of mental health.
Thank you. Mickey, any parting words?
No parting words, except that, keep the faith. Life can be good, even with serious issues, and we can be effective advocates for our family members and for ourselves. And I'm hopeful that the national discussion will advance the cause.
Thank you. Christina? Oh, Mrs. Subhan? I didn't see him. Is that why? I think he's out.
Put a note in the Mr. Subhan put a note in the chat to say he had a meeting at the hour. He sent his apologies.
Okay. All right. So Christina?
Mr. Subhan was up.
He's left for another meeting.
Okay. Yeah, so I certainly want to thank all the panelists and the audience and for the many wonderful questions. And Cindy, I would ask that you, if you could put the link for your organization there, in so that people could link into that. I see we have the link for One Mind, and we have the One Mind at Work, which is a wonderful suggestion. And if Cindy, if you could put your link in there, the people who are in the audience would have a chance to see that. What I think was so wonderful about this discussion today is that I think we explored in many ways the intersection of mental illness, the community, national policy, and the individual. And the important thing, of course, is to understand that they all come together. They're all important. They're all related. And we do a better job in some areas than others. And we worry about, providing mental health services for those people who can get to services. But we don't do such a good job of early identification. We do a less well job of supporting the people who are supporting the people with mental illness. And that's what we've been talking about here today. But I think the panel clearly demonstrated how all of these things go together. And it's our job as advocates to help them be put together and to help them all have an equal voice. And so I look forward to the Thursday morning session. We only have that 1 hour, which I would imagine will get extended, to discuss what has come out of this conference and what are some of the hallmarks that we can hold ourselves accountable over the next year. And I certainly hope that with Alicia's help, we'll be able to get the carers in there. And I ask all of you to try to join that conversation at 11 o'clock Guyana time on Thursday morning to be sure that we get it in as part of the national conversation and the national plan, that carers, in fact, we must find ways to support them. And I thank all of the individuals, both on the panel and in the audience, who gave us great suggestions. And I look forward to doing what I can do to help Guyana move all those things forward. It naturally has to come out of Guyana. Your culture and your needs are different than those in any other country. But it's fundamental. It's fundamental that family members and carers are critical. And whatever we can do to help you make that come about, I think everyone on this panel is eager to help you. And sei gesund, good luck, and let's keep the conversation going. Thank you very much.
So thank you to our panelists, and thank you for listening, and thank you for being a part of this conversation. This is not the end, this is only the beginning. And so we're looking forward to have more of these conversations. So feel free whenever those conversations come up to join in and be a part. So thank you again, and thank you to our panel.